goodness for folks like you. I think we could, we wouldn't be as good a community without our wonderful hospice organization. Now, run us through some of the services. We've kind of touched on those a little bit, but run us through what you folks offer.
Well, obviously, we do offer a team approach to care. And the one thing that I think our staff, we work with them on is what we want them to do is when they start meeting with the patient and their family is to establish what is that patient's goal, or if the patient's not able to say, what is the family's goal for that person? And then the whole team comes together and tries to help that patient and or family reach those goals. Now, to do that, we have a whole team. We have our own medical director, plus we have a staff physician, and we are actually one of the few organizations that the doctor makes house calls, and our doctor, Dr. Abramson, is running all over Donna County visiting patients in their homes. Of course, we also have nurses that go out, certified nurse assistants, which do all of the personal care like bathing patients. We have a medical social worker that helps families just with some of the emotional issues and some of the financial issues, planning for funerals, those kinds of things that have to happen that really no one's real comfortable doing. And then, of course, spiritual support. We do provide chaplains for those patients who would like that kind of assistance. And then, of course, our wonderful volunteers who often just go out and sit with the patient so a family member can get away from the house, go to the grocery store, or go get their hair done. Because very often when someone's had a lengthy illness, the caregiver has kind of becomes trapped in the house of not feeling like they can leave. So that is the core of what we do as far as personal services. And then, of course, as you mentioned, any medical equipment they need, any of the prescription medications they need related to their illness, any medical supplies, all of that is provided by the hospice at zero cost to the patient and or family. There are no copays, no deductibles. Obviously, Medicare will cover hospice, Medicaid, the Donna County Health Services Fund covers hospice, as well as most private insurances. And then, of course, we do have a charity care fund for those patients who can't afford to pay. We take care of them anyway.
See, I was going to ask, do you have something analogous to the indigent fund for the county hospital?
Yes, we do.
And so let me make sure I get this right. Somebody comes to you, they don't get a bill. Right. Whatever their insurance, Medicaid, Medicare may cover, obviously depending on their age, that's all you collect.
That is what we collect, except for the room and board at La Posada. La Posada is our hospice house.
There's a nightly or weekly charge,
There is a daily charge, and what we do for families is try to see what they can financially afford. Obviously, if they can afford to pay for the room and board, then we collect it. If they cannot, then they're allowed to stay and pay whatever they can afford to pay. I mean, some patients can pay $5 a month and others can pay the full charge. We think that's really important to be good stewards of the money. When people donate money to us, they are expecting us to use it wisely to take care of people that need help. And so we try to be very good about for the room and board. If people have the resources, then we do ask them to pay for the room and board. But if they don't, they get care anyway.
Not one person turned away.
Right, not one person turned away. 100%
equality, and that's the way things should be. The benefits of choosing hospice care versus other options.
Well, I think, obviously if you ask me, I think
hospice
care is, I'm a big advocate of hospice. I think it's the best choice. However, I think the important thing for people to realize is it needs to be what it is that they want. Because there are people, if you say, if you were told you had very little time left and you have like a 1% chance of a cure, there are people that would say, you know what, I want to fight all the way to the bitter end. I want to take that 1% chance or that 0.25% chance, and I want all the plugs, all the stops pulled out to try to keep me alive. And for those patients, definitely the hospital would be the best option to fight, the fight all the way to the end. For a lot of people, though, they do say, when it becomes evident that most likely cure's not possible, I want to be kept comfortable. I want to change my focus to something else, to making my whatever days I have left the best they can be. And for those people, hospice is the best option, in my opinion.
Are there other hospice organizations in southern New Mexico, West Texas? You had talked about there's one in Albuquerque.
Right.
How about in our southern strip of the
southern
state?
Strip. There are other hospices. Amber Care is a home care and hospice organization here in Las Cruces. There is Sierra Home Care and Hospice out of TRC. Okay. Alamogordo has a hospice, as well as Deming. So many of the surrounding areas do have hospices. In El Paso, I believe there's like 7 different hospice organizations. Albuquerque has, I think, 17 hospices. So there are many hospices available, but as I said, we are the only one. And in fact, El Paso, I don't believe, has a hospice house, which again is amazing.
That's amazing, you know, given
their
compare
size.
the population.
Right,
they're
exactly.
so much larger than Las Cruces. But to be clear, Amber Care is a private for-profit organization,
yes,
and you folks are
nonprofit.
Now, is it nonprofit, not-for-profit? I know there's a little bit of a difference, isn't there?
Not really. I think
really.
It's just semantics. Yeah.
Okay. Now, we had talked about indigent funds. You have something very, very similar. Once someone with an illness gets to a point of needing hospice care, things can happen pretty fast.
That's true.
But for both the patient and the family, what are some things someone can do ahead of time while they're healthy,
right,
to plan ahead?
Well, and I think that's one of the things that, one of the reasons we find it so important to get out in the community and talk about hospice and what we do is what we want people to do. And in fact, yesterday was National Health Awareness Day as far as around the issue of advance directives. Oh. So what we encourage people to do is talk with their family members and for themselves and just think through, while I'm healthy, while there's no pending crisis going on, what is it I want? What is it I would want toward the end of my life? Or if I were delivered the bad news that, you know what, I only have 4 months to live. And you know, Charles, I think if your doctor told you, Charles, you have 4 months to live and medically there is 0 chance of you surviving, it would probably make a difference in the decisions you made in the coming 4 months of what you would do, where you would go, how you would spend your time. So we really encourage people ahead of time, think about what would you want? What would you want your care to look like? Where would you want to die? Do you want to be at home? Would you rather be in the hospital plugged up to the machines? And most importantly, filling out those advance directives and saying, if I get to the point where I can't make decisions for myself, who do I want to make decisions for me? And what kinds of decisions do I want them to make? You know, I want machines, I don't want machines, I want a feeding tube, don't want a feeding tube. What are those decisions? Because unfortunately, someone has to make those decisions, and without the proper direction, you know, families are often left fighting amongst themselves, as we saw in the Shivo case, or just almost paralyzed because they don't know what to do or what mom or dad or grandma or grandpa would have wanted.
And you touched on exactly what I was hoping you would there at the end, where my late mother, fortunately, she made all those decisions. She was very clear in her living will and those kind of things. And if she needed more care than the family could provide, she wanted to be in assisted living. She wanted hospice if she became terminal for something. Right. So thank you so much. We only have probably about a minute and a half or so to talk. So let's talk about getting involved. What should someone do?
Call 523-4700 and say, I want to get involved. I want to volunteer. And there are many ways you can help.
That's exactly what was my next question.
You could certainly help in the office. We have a lot of people that want to help but just don't feel like they could be in direct contact with patients. And there's a whole lot of things they can do. Office work, and there's filing, and there's errands to be run, and papers to be picked up at doctor's offices. There's always landscaping around the place to do. In fact, we had a group of mid-schoolers from Mesilla Valley Christian School come down and help us transplant plants with this new construction going on. And then, of course, patient care. There are always a great need for people that are willing to sit with patients and go in and have that direct contact with someone who has a life-limiting illness.
And don't necessarily need to be a medical professional
to do that. No, they do not need to do that.
Donna, if you can believe it, we're out of time.
That's
an
amazing.
a wonderful and informative half hour. Thank you so much for coming on.
Thank you, Charles. Have a good day.
That just about does it for this week. If you have a question or comment about the show, you can call the Minding Your Business hotline at 646-7350 or email me at charlescomer@yahoo.com. Again, I'd like to thank my guest, Executive Director of Mesilla Valley Hospice, Donna Brown, for coming on the show.